The next part of microbiology that we'll be starting with is mycology. Now, mycology, as all of you know, deals with what? It deals with all the fungal organisms that you have, and especially after the era of COVID, fungal organisms have become extremely important in all your exam patterns. Now, we are going to divide this chapter in a very logical manner. First, we'll start with the introduction and the classification part. After that, once you've got a basic outline of what exactly the chapter holds for you, we'll be going ahead. We'll be talking about every fungal organism in detail, and we've decided to go system wise. When I say system wise, from superficial to deep fungal infections is what we'll be talking about. So let's begin right away. The first thing that I'll be teaching you is the structure of a fungus, and in that you have two aspects, a cell wall and a cell membrane. Please remember, the cell wall is going to contain chitin. So the cell wall of all the fungal organisms will be containing chitin. Similarly, the cell membrane of all the fungal organisms is going to have ergosterol, but here we have an exception. Please remember, all of them are going to have ergosterol in their cell membrane except one very famous fungus which you must have heard of, and that is Pneumocystis carinii. And there's a very famous other name also that you know it by, and that is Pneumocystis jirovecii. So all of you know that this is a very common infection that you find in HIV positive patients, right? When the CD4 count goes below 200, we'll be talking about it. So this is an opportunistic infection in HIV positive individuals. And what is special about it? That it does not have ergosterol in its cell membrane. Well, this was the basic outline about it. What are we going to go on to next? We are going to start off with the classification based on the morphology. So what do you need to know? There are 4 groups. Now that is how we've classified the entire fungal system. The first group of organisms is known as the yeast. The second one is referred to as yeast-like. The third one is said to be mold or hyphae. And the last one is the most famous out of all of these, and that is the dimorphic fungal organisms. So please remember, yeast, yeast-like, mold and dimorphic. Let's go into that one by one. Let's talk about their details. So when I talk about yeast, the first one that I've put up in this category, yeast, do you know what you understand by yeast? I'll draw one organism over here and I'll show you a small little bud coming out of it. So in very simple words, please remember, yeast is nothing but the budding form. It's going to show you presence of buds. Apart from that, please remember there is something known as the second one, that is yeast-like. When I say yeast-like, means the element of yeast has to be there, means there is an organism and it is going to show you the budding, so the element of yeast is there. But apart from that, sometimes these buds become very, very long. So instead of looking like a tiny little bud like this, it's going to look like a long bud, and from which that another bud is going to come out and another bud is going to come out. What is this long buds known as? These are referred to as the pseudohyphae. So when we zoom into these two pictures, all of you can clearly analyze that I have a particular organism and it's showing me a tiny little bud here. So what do I call this? This is said to be the budding form. Whereas now in the next picture you see those tiny buds have become very long. So what would you now want to call them? Now they will be referred to as the pseudohyphae. So please remember that a yeast-like organism is the one that is going to show you both the yeast the phenomenon, that is the budding, and the pseudohyphae, of course. And what are the examples that come under it? So please remember, yeast is going to include Cryptococcus, and yeast-like, which are going to have the pseudohyphae, they will include Candida and Malassezia. These are the two main set of organisms that you have to learn. Repeating, yeast is going to have Cryptococcus and yeast-like will have Candida and Malassezia. Now, there is one information which I want students who are particularly targeting the INI-CET exams, you guys should be knowing that in the yeast variety, there is another set of organism which is known as Saccharomyces. Now, let me ask you, where else have you studied Saccharomyces cerevisiae? I'm sure you've heard of this particular thing. Where have you read Saccharomyces cerevisiae? So go back to your medicine lectures and even your pathology lectures. Saccharomyces cerevisiae is a very important organism that you have studied in Crohn's disease. And over there in Crohn's disease, you have also studied that there is an antibody called anti-Saccharomyces cerevisiae antibody. So now you exactly know where that Saccharomyces has come from. It's come from the fungus. And which family of fungal organisms? From the yeast, the budding form. Another extra edge information for the INI-CET that I want to tell you is a set of two more organisms which are known as Trichosporon and Hortae. I'll be teaching you those in a while. Trichosporon and Hortae belong to the yeast-like species, means they are going to show you the pseudo-hyphae also. Okay, so that was extra information. Now, having discussed the yeast and the yeast-like, having discussed these two, we are going to go ahead and talk about the mold or the hyaline form, the mold hyphae form, and that is exactly what you have to know. So look at what I've written over here. I have eliminated the word pseudo. Now there is no long budding. Now there's actually going to be a long single structure called a hyphae. That is what you have to know. So this hyphae is known as a mold form, and it's of two types. See, one is aseptate, means it's a straight line like this. It's going to be a straight line like this. And the other one is septate. When I say septate, means there are going to be further segments that are present inside it, septa that are present. So let me ask you a question. Which one of these would you call, or what would you categorize this as? So as you can see, there are hyphae, but I can see lines inside it. So which one would I categorize this as? As the septate hyphae, right? Okay, so now having said that, the aseptate hyphae, because as soon as I say aseptate, the COVID era comes up in front of you, because remember the black fungus, remember the mucor. The mucor is aseptate, and mucor belongs to which family? It belongs to the Zygomycetes. So Zygomycetes is a family which has a lot of organisms, but mucor is the hero of the story after COVID, of course. So remember, the mucor is aseptate, so that family, Zygomycetes, comes under it. Comes the tough part, which are all the ones which have septae. And if you see, I have divided further into two categories. One is going to be pheoid and the other is going to be hyaline. What do we mean by that? See, pheoid has the word melanin written in front of it. Means that this is the one that is going to include a pigment. There is going to be some element of pigment. How have I learnt it? I'll tell you in a while. Hyaline, on the other hand, there is not going to be any pigment. So now I'm going to change the, the methodology or the pronunciation a little. So now I'm going to call it melanin. Why am I calling it melanin? And hyaline, I'm going to call it as hyaline. That is how I'm going to change the terminology. I'll call it hyaline, because now remember that under the melanin one, why did I say melanin? Because all the things are going to come under it. Means Piedra, Alternaria, Madurella, Curvularia. These are all the ones which are going to contain melanin or pheoid. So repeating, Piedra, Alternaria, Curvularia, Madurella, AA things. Whereas when I'm talking about hyaline, why did I emphasize on the Y sound of it? Because all the UY sounds are going to come under it. Means what? When I'm talking about the Fusarium, Acrimonium, Penicillium and Aspergillus, so all the UY sounds come together. That's the best way, rather than learning it as mnemonics, which are usually written in other textbooks, and we honestly never tend to remember those mnemonics later on. This is the best one. So remember, whenever they're talking about melanin, all the AA things will come. And whenever they're talking about hyaline septate, all the UU sounds are going to come across with it. Finally, with which we wrap up our third feature also, that is the mold or the hyphae. What are we left with? The fourth one, and that is dimorphic fungus. Now, when I'm talking about dimorphic fungus, and after that I'm going to take you to a recap also. When we talk about dimorphic fungus, the word itself is making a lot of sense over here. That means this is going to exist in two morphologies. There are two morphologies in which it exists. What are those? Both the forms that we studied. Till now, we have studied something known as the yeast form, which is going to have that budding. And the other one is known as the mold or the hyphae form, which is going to be a true hyphae. So there are two forms, and this fungus exists in both. It can exist in a yeast form also, and it can exist in a mold form also. So what do you have to know out here? Remember, yeast is going to be present at 37 degrees centigrade. Mold is going to be present somewhere around 25 degrees. Some books mention 22 to 25. Some mention 25 to 28. So because there's so much of confusion, I've taken up the center value, that is 25. So how do I learn this? Which feature is at which temperature? So remember, the way you say yeast and heat are rhyming. Mold and cold is rhyming. That is how you learn it. So yeast is heat, means it's at a higher temperature, 37. Mold and cold is rhyming, lower temperature, that is 25 degrees. Now, well, having said that, which are the organisms that are going to come under this, that they can form yeast also, they can form mold also? So see, am I not talking too much about temperatures, 37 degree, 25, heat, cold? So that is how you learn. That is the mnemonic. So the mnemonic that you have over here is body heat probably changes shape. Body heat probably changes shape. So what do I mean by that? That now let's start with the answering of these. So B stands for blastomyces. B stands for blastomyces. H stands for histoplasma or histoplasmosis. P is going to actually have two things. P is going to be Penicillium marnefi. P is referred to as Penicillium marnefi. P is also for paracoccidioidomycosis. Paracoccidioidomycosis. Next one, the C. The C is going to be for coccidioidomycosis. And lastly, the S that we have is for sporotrichosis. Sporotrichosis. So let's do a recap over here, guys. When I say body heat probably changes shape, B is going to be for blastomyces, H for histoplasmosis, P for two things, Penicillium marnefi and paracoccidioidomycosis, C for coccidioidomycosis, and S is going to be for sporotrichosis. Now, well, having said that, this is body heat probably changes shape, and easy to learn mnemonic because I'm talking about different temperatures. So the mnemonic is in hand with it. Okay, coming all the way back, that finishes off the classification for us. We have yeast, then we have yeast-like, then we have mold, and then we have dimorphic. Want to do a very quick recap? Yeast is going to have the very famous Cryptococcus for all of us. Yeast-like is going to have the two very famous, that is Candida and Malassezia for us. Then we have mold, that is going to be the hyphae form, which can be of two types. Either it is not going to have septa, which is going to have the hero of the story, that is Mucor zygomycetes, or it is going to be septate. Remember, under septate further there are two varieties. Either it is going to have melanin. So remember, melanin had all Piedra, Curvularia, Madurella, all the AA things. And the other one is going to be hyalene. So that was going to have all the YU sounds, acrimonium, fusarium, all those U sound ones. Coming lastly to the dimorphic fungus, and in dimorphic fungus we have body heat probably changes shape. So these were the organisms that were put up under it. That's a very quick summary of the classification on the morphology that we have done, because here I was only talking about the shapes. Now I'm going to move ahead and talk about the next form, which is based on the spores. So when I say based on the spores, every fungus can either have the presence of sexual spores, that's one possibility, or it is going to have the presence of asexual spores. So there are two things that it can have, that is sexual spores and asexual spores. Now first, learn the mnemonic of any one of them so that the other one becomes easier. So when I say sexual spores, we are going to learn ZABD, or ZAB also is good enough, and everything other than that will come under asexual variety. So how do I learn this? Remember, when I'm talking about the sexual spores, as I just now told you, sexual spores are going to be ZABD. So what is ZABD, and especially ZAB, means we are talking about zygospores, ascospores, and basidiospores. So what is ZAB? Zygospores, ascospores, basidiospores. Firstly, no points for guessing that zygospores are seen in which family? They are seen in the zygomycetes family. Yes, and don't worry if you don't know the members of it, we will get to know eventually. So zygospores are present in the zygomycetes family. Ascospores are going to be present, A for A, in the Aspergillus, and basidiospores are going to be seen in the presence of Cryptococcus. They are seen in, again, B, C coming together. So basidiospores are seen in Cryptococcus. Let's do a recap. When I'm talking about the three, that is ZABD, we have Z for zygospores, that is zygomycetes, A for ascospores, which is Aspergillus, B for basidiospores, which is seen in Cryptococcus. I have a couple of pictures over here that you can see. So you will obviously see there's a long structure over here, and I can visualize that there are some tiny structures inside it. These are the ascospores, and this will be labeled. So if this is a labeling of an ascospore, which organism will you think of? You'll think of A for A, you'll think of Aspergillus. Similarly, the next one, you can see a basidia and you can see the basidiospores which are coming. As soon as you see basidia, which organism will you think of? You will be thinking about Cryptococcus. So having said that, this was about the ZAB. Why did I call it ZAB-D? There is another family of fungal organisms which are known as fungi imperfecta. Remember, they do not have any sexual state or sexual spores, and that is why they are referred to as fungi imperfecta. Again, something that can come to you as a one-liner if at all. So repeating, when I'm talking about sexual spores, we have the mnemonic ZAB-D, and after this, whatever will be written will come under asexual. So now let me show you all the miscellaneous ones quickly. What all can we see over here? We have something called arthrospores. Now, what are arthrospores? I've got you some pictures. See, there are some pictures which will come without a labeling, which you have to identify. So this picture over here is the photo of arthrospores, and please remember that arthrospores are very, very characteristically seen in coccidioidomycosis. Right now, I am not showing you or giving you any mnemonics, because for all these fungal organisms, I'll give you mnemonics. Then this part of fungal morphology will become very, very simple. Right now, you're just becoming familiar with what all terms we have, right? So yes, coccidioidomycosis, and let me tell you, even dermatophytes, even the dermatophytes are going to show you the arthrospores. But just remember, look at this picture. There's a question you'll find in your Q bank and your PYQs. How do you identify arthrospores? They are condensation of the different fungal elements. It looks as if, if I try to draw it, it will look like this was a fungus hyphae, and that hyphae basically divided into multiple segments. That is the kind of appearance it gives. So very commonly there's a question on arthrospores that comes, that arthrospores is the condensation of hyphal elements. It's the condensation of the different hyphal elements. Go back to your Q bank, you will find this question. Okay, coming to the next, we have something called blastospores, which you just have to know. So I told you, other than ZAB-D, everything is coming over here. So blastospores is here. Then we have sporangiospores. Sporangio is the one on which you get a photo, and you see that on the bottom side. Okay, you can see a sporangiophore, and you can see sporangiospores coming out of it. You can see those round ball-like structures and those sporangiospores inside it. That is something you are going to find in zygomycetes, the same hero, mucor wala, zygomycetes. So now that gets me to a point of thought, and that is that when we are talking about the zygomycetes, right now only you will say that I had told you a mnemonic called ZAB-D for sexual spores, and I told you that, if I take you back, I told you that zygomycetes is going to show you zygospores, which was a sexual spore. Now, so I can write that the one type of spore is going to be the zygospores, right? On the other hand, now I'm saying you're also seeing sporangia, so you're also seeing sporangiospores. So can I say this is basically showing you both? This is that one family. This is that one family which is going to show you both the sexual forms also and the asexual forms also. The sexual form is simple. For zygo, it is zygo, that is zygospores, and asexual form is those round structures called sporangiospores. Other than that, where there is something called C for C, chlamydospores. Can you see these spores with a double wall? These spores with a double wall. So that is how you identify the double-walled spores. They are seen in C for C. When I say C for C, we mean Candida. So remember, chlamydospores are seen on candidial infection. And lastly, you have these two things written, conidia, which is macro and micro. So no brownie points for guessing that the macroconidium is going to be large and the microconidium is going to be small. And I'll tell you eventually which organisms show this. So having said that, these are the classification on the basis of the asexual spores that we have. So if I can come all the way back and tell you what all was I going to discuss, like I said, under the sexual spores, we have zygomycetes, we have ascospores, we have the basidiospores, and we have the deuteromycetes, which is basically the fungi imperfecti. After that, arthrospores, blastospores, then we have sporangiospores, then we have chlamydospores, then we have conidia. All the other miscellaneous ones will nicely come under the asexual variety. Having said that, the classification is still not over, right? How do you identify the different vegetative states? Now, this is something again for students who are targeting INI CET, not very important for the NEET and FMG students. It's important more for INI targets. So I can see after the spores, how do do they get classified on the basis of the vegetative state? Either they can look like spiral. You can very well see that over here I'm seeing that there is some spiral configuration. Or they can have a pectinate body. Pectinate is going to look like a comb basically. Pectinate is looking like a comb. Then there is a chandelier. Everyone's aware of what is a chandelier. Chandelier, the beautiful glass chandeliers that you have in big hotels, the ones that are going to hang like this. So this is also looking like the horn of a deer, antlers horn. Yes, so that is going to look like the beautiful hanging chandelier. Then if it looks like a nodule, you call it a nodular vegetative state. And if it looks like a racket, a tennis racket, then you're going to call it a racket hyphae. So what are the different forms? Let's do that quickly once again. If it's spiral, you name it like that. If it looks like a comb, it is going to be pectinate. If it looks like a hanging chandelier, you call it the same. Round like a nodule, you call it nodular. And if it looks like a tennis racket, you call it a racket hyphae. But is it only about knowing the shape? You need to know which organism shows you what. So you don't have to learn examples of all. But there are some examples that I want you to know. So spiral hyphae is going to be seen in trichophyton, mentagrophytes. I'll be showing you so many trichophyton. Why mentagrophyte? How do I learn that? Because the way you are drawing spiral, spiral is looking like an M, right? The way we had drawn spiral, spiral is looking like an M. So we can call it as mentagrophyte, shows you the spiral hyphae. Next, for pectinate, you don't have to learn an example. For chandelier, so when I said chandelier, so the way you say chandelier, you get the SH sound. Same way when you say Schonleni, so repeating, when you say chandelier versus when you say Schonleni, so trichophyton Schonleni shows you the chandelier form. That is also sorted. Coming on to nodular, you don't need to know. And the last one is going to be what? You are going to have something the toughest, that is epidermophyton flocosum. So remember, epidermophyton flocosum, it has too many F wala sound because I have learnt it as it is racket. I've not shown you the usual tennis racket. I've shown you a racket which you'll find in every Indian household, and that is the racket with which you kill the flies, right? The fly wala racket. So yes, that is what I'm going to teach you. The fly racket is going to be the shape of all the FF organisms, that is epidermophyton flocosum. So epidermophyton flocosum shows the fly racket kind of an appearance. These are the three main ones. Repeating, trichophyton mentagrophytes, M like a spiral. Trichophyton Schonleni, so Schonleni like chandelier. And epidermophyton flocosum, all the F sounds coming. So this is going to look like the fly racket. Okay, all said and done. Let's move on to the next classification that we have, and that is based on the location, the real one that is going to help us in clinical diagnosis. So the first one is going to be involving the superficial mycosis, the superficial layer. What is going to happen under it? There is something known as tinea versicolor, which we'll be talking about, along with a lot of other tenias. So all the other tenias are going to come under dermatophytes. So we have tinea versicolor and we have dermatophytes. These are going to be superficial. Then after the skin, we come down to the subcutaneous tissue. Subcutaneous tissue has MRCS. MRCS is one of the famous exams and the toughest exams that we have. So subcutaneous, what is MRCS? M is going to be for mycetoma. R is going to be for the very famous rhinosporidiosis. C is going to be for another very famous organism, that is chromoblastomycosis. And S is going to be for Sporothrix Schenki or sporotrichosis. So what is MRCS? A quick recap. M stands for mycetoma, R stands for rhinosporidiosis, C is for chromoblastomycosis, and S is for sporotrichosis. Having said that, now come deeper into the organs, the deep tissues or the systems. And in these, all the dimorphic fungi are going to come. So all the dimorphic fungi which I just now taught you, if you guys remember, body heat probably changes shape. Yes, all of those are going to come. Other than that, many opportunistic infections are going to come. Like for example, we have Candida, we have Cryptococcus, we have Aspergillus, we have mucormycosis. So all of these remaining ones, basically, in simple words, how I have learnt it is, all the dimorphic fungi, number one, and all these opportunistic infections that we have, All of these are going to involve the organs. They will involve the different systems, right? So now we've done the classification on the location also. Number one, the superficial mycosis. Superficial is all the taenias, taenia versicolor, taenia coming under dermatophytes. Then subcutaneous. Subcutaneous is MRCS. Then the deep ones, deep are dimorphic and the opportunistic infections. So that wraps up our classification on the basis of the location. Moving forward, we are going to now discuss the laboratory diagnosis. Before we start with the laboratory diagnosis, the first thing that you have to know is sampling. Where will you take the sample from? Now, when I talk about sample, I've got a long list because I can never predict where the fungal infection has occurred. Now, when I talk about the usual sites, yes, hair, we all know hair, skin and nail. Dermatology is going to be very famous. So these are the samples that will come to you. Fungal infections can come to you with pus. So maybe they've given you a pus sample, a few ml of pus has come to you for examination. Lung is a very common site. So if there is a pulmonary involvement, the most common sample that I'm expecting is sputum. If sputum is not available, they might have given me bronchial washings or a bronchoalveolar lavage. And let me tell you, there is one infection in which sputum is not formed. That person is not going to have sputum. That person is going to have dry cough, and that infection is going to be pneumocystis carinii. Pneumocystis carinii, and pneumocystis carinii is definitely going to come. How will you make the diagnosis? If there's no sputum production, you're going to go ahead with a bronchial washing or a bronchoalveolar lavage. Okay, lastly, if nothing works, then you need to go in for a lung biopsy, which is a little rare thing to do, can be done in cases of certain fungal infections, which I'll talk about in a while. Other than that, there can be blood sample. If there's a meningitis case like cryptococcal meningitis, you'll get a CSF sample. If there's urine or any body fluid involvement, you'll get a sample accordingly. So all said and done, what we mean by this is that depending on the site of or the organ affected, you are going to get the sample. But yes, repeating, some of the most important samples will be hair, skin and nail. Moving forward, what are the different techniques by which we do the detection? So please remember, the first one is going to be the direct examination. Means you are going to just pick up the whatever hair, skin and nail is there, and you're going to look at it under the microscope. Do you know how do we do a direct examination? It is done by something known as a KOH mount. I'll first start with this. I'll first start with a KOH mount. This is how the picture of a KOH mount is going to look like. So first and foremost, what is KOH? KOH is not any stain. It's not any pink, blue, green color stain. KOH is potassium hydroxide. And how much percentage am I using? I'm using a 10 to 20% of potassium hydroxide. Reason, why am I using this? And I can see the picture also. I'm not getting any color. It's a totally transparent kind of a slide. Please remember, this is used because K for K, this is going to digest keratin for me. Potassium, KOH, is going to digest keratin. Why do I want to digest keratin? What kind of samples am I dealing with? I'm dealing with samples like hair, skin and nail, right? When I'm dealing with hair, skin and nail, these samples are the ones which are very, very rich in keratin. Now, if they're very rich in keratin, just imagine a nail. A nail is going to be so thick. How can you just put a nail under the microscope and expect that you'll see a fungus growing inside it? No, you'll have to remove all the keratin from the nail. You will have to digest the keratin. So see, you digested the keratin and then you started seeing beautiful hyphae. Beautiful for us, obviously not for the patient, but yeah, you can see these long beautiful hyphae that are there, but you could only see that once the keratin was removed, and that is exactly what is done over here. Well, having said that, this is about the KOH mount. That was direct examination without putting any colors. The second thing that you'll do is, first you'll start putting some blue, green, pink colors. So let's start with all the stains that we have. The first one, that is quite a famous one, you can suddenly see that the fungal hyphae have become all black, right? So this stain is known as the GMS. This is known as Gomorrhees or Grocott methenamine silver stain. This is known as Gomorrhea or Grocott methenamine silver stain. Now I'm going to tell you, and I have told you multiple other times also in your path and microbiology lectures, that whenever the word silver comes up in a particular stain, the color that you are going to get is always going to be a black color. So that's a trick which will help you solve so many other things. You must have heard in, do you remember, let me do a very quick recap. Do you remember in your pathology lectures in melanin, have you done a melanin stain, M for M, melanin, Mason, Fontana, silver stain? Again, Mason Fontana silver stain gave what color? It gave a black color. So whenever, and I ask you one more thing from bacteriology, what is the stain for Helicobacter pylori? For Helicobacter pylori, I hope you've been through the bacteriology lectures. Warthin starry silver stain. Again, Warthin starry silver stain gives what color? It gets you a black color, because anything with the word silver, is going to get you a black color. So here we have Gomori or Graucoat methionine silver stain for fungus, that gets you a black color. So this was the first stain that we had. The second one that we have is a very usual one. Suddenly they've become all pink. The hyphae have become all pink. So what do I need to know? Please remember P for pass and P for pink. And what is pass? If you want to know the full form, pass stands for periodic acid Schiff. If you're not learning the full form, you're not missing out on much. So let me tell you, periodic acid Schiff is P for P. Pass is going to give a pink color. Coming to the third and the fourth, which I want you to first read and then I want you to ignore. The next two that we have are going to be, there's something known as the gram stain. Gram stain is something I usually do for bacteria, right? Gram positive, gram negative. But please remember, for fungus also, and what is the color? With the gram stain, I'm getting what color? I'm getting a purple color. I'm getting a purple color. This means fungal organisms are gram positive. Fungal organisms are gram positive. Coming to the fourth one, and that is what? We have something known as the very famous. Can you finish micro and path without discussing the famous pink and blue? That is the HNE stain, right? So please remember HNE, you can see all the fungus has become pink and blue. So that is the HNE stain. Well, having discussed it, so all in all, when I go back, there is a black color stain called the Gomori methionine silver. Then the next one is going to be the pass or the pink color. Then we have the third and the fourth one, which I told you, read and forget. So what is gram stain? Gram stain is going to give you a purple color, gram positive, and there's an HNE stain. Finally, coming to the fifth one, and the fifth one is known as CFW. What is CFW? It is calco flower white. Now, there is a very interesting mnemonic behind it. Please remember, when I talk about calco flower, the flower word will remind you that this is a fluorescent stain. See, the flower word is reminding you that this is not a regular stain, this is a fluorescent stain. So, can you now see the background is all black? I've got you a black background because it's all dark, and what is going to come up in front of it is something shining. Something is shining. So why is something shining? Because you've used a fluorescent stain, right? But having said that, did you also notice something? That the entire fungus has not become shiny. Only the outline over here and the budding, only the outline part of it over here and over here is becoming shiny. Why so? Outline means what? Outline means cell wall. And have I already told you that what is the cell wall made up of? Go back to the first sentence of this chapter. The cell wall is made up of chitin. So remember, calco flower white binds to chitin. So now the mnemonic is complete, which means the C of calco will remind you of C of chitin. It binds to chitin, that is only the cell wall part. And the floor word will remind you of fluorescent stain. So calco flower white is a fluorescent stain. Coming to the sixth stain that we have, and that is now sixth and seventh. Now let me tell you, there's a very famous organism which you will definitely get a question on, and that is Cryptococcus. And the question will always be related to cryptococcal meningitis because that's the most common organ that it affects. Now, having said that, please remember, cryptococcal meningitis, a meningitis patient coming to you, what sample will you be taking from the person? We'll be taking a CSF sample. Now, when I talk about a CSF sample, the stain that I'm going to put is a negative stain. First, let me give you examples of it. Negative stain is going to be what? It's India ink and nigrosin. There's a stain called India ink and there's a stain called nigrosin. What do you need to know about these? Why did I call them negative? And the same concept I have taught you in your general microbiology also. Why do we call it negative? Because look at the background. It's actually the background that you are going to stain. The background is stained, and what is not stained? Look at this. What is this white thing coming? Something has not picked up the stain. That is the capsule of Cryptococcus. That is the capsule of Cryptococcus. That is what I wanted to tell you. Cryptococcus is a capsulated organism, and that capsule is very, very weird. You know, you try to give it any pink, blue, green color, capsule doesn't take any stain, it doesn't take any color. As a result of which, what happens is you will have to do the opposite approach. So I don't know whether you guys are pretty young and don't belong to our generation, but long back when you didn't have too many phones to click photographs, we used to take photographs with a camera and a Polaroid, and we used to have a reel, and the reel used to then print out a lot of negatives. Maybe you've seen that with your parents. Makes me feel a little old while I say that to you. But yeah, negatives, the concept, I'm sure everyone's seen it. The concept of negatives was that the background was dark and the person's photo was coming highlighted out, right? The same thing is happening in a negative stain. That is, the background is coming out to be dark, and what is highlighted is the cryptococcal capsule. That is, if you received a CSF sample, that's the trick over here. What if the person had a biopsy done? Not a CSF sample, but what if the person had a biopsy done? So please remember, if you will receive a biopsy like cryptococcal meningitis or brain biopsy, or maybe cryptococcus has affected the lungs, so lung biopsy. If you ever get a biopsy, then what stain will you use for cryptococcus? Then for the same cryptococcus, I won't be using India ink. I will be using this nice rose, reddish, pinkish color stain, and that is known as Mycology. This stain is referred to as Mycology. So that is the 7th stain that you have done. So remember, for cryptococcus, reading what sample has been given to me is very important. If they have given you an India ink or a negative, or they've given you a CSF sample, then you go in for India ink or nigrosin. But if they've given you a biopsy sample, then you go ahead with Mycology. Having said that, these were all the different stains that you had. So coming back, first you did direct examination with KOH, then you went ahead with stains. Let's do a quick recap. The black color stain was Gomori methenamine silver. The pink color stain was P for pass. So pass was positive. For cryptococcus, we had the negative stains if you were talking about the CSF sample. For cryptococcus, you had Mycology if you were talking about the biopsy sample. And 2 miscellaneous ones were gram positivity and HNE stain. So that wraps up all the stains for us. Now coming to the third one, and that is a culture, and this is a previous year question, very, very important for all of you. So what is the culture that we use? The very famous Sabauroud's dextrose agar, that is SDA. Sabauroud's dextrose agar, or SDA, let's dissect it, is obviously going to contain dextrose, there's no doubt about it. The way you write SDA, the question that has come in your previous years is that what is the pH at which you are going to deal with it? So remember, the way you write S, it either looks like a 5 or a 6. So I've clubbed it. It is a pH of 5.6. The basic concept is that they ask you that this is an acidic pH. Okay, we require an acidic pH. Repeating once again, the way you write SDA is going to be a 5 or 6. 5.6 is the pH that is there. Apart from that, I have noticed that SDA has antibiotics also. What antibiotics? Gentamicin, chloramphenicol have been added. Why? So that it can inhibit or kill the surrounding bacteria. For the killing or the inhibition of the bacteria, I have added antibiotics. Apart from that, we can also have cycloheximide added. Why do we have cycloheximide added? So please remember, you also want to finish off other saprophytic fungi. You don't want any saprophytic fungi to grow. You only want your pathogenic fungi to grow. So you basically want to get rid of 2 things. Number 1, you want to get rid of the bacteria. So for bacteria killing, you are going to give antibiotics. Second, you want to get rid of the saprophytic fungi. So for that, you're going to have cycloheximide. So these are questions that you get. Which antibiotics are you using? Gentamicin and chloramphenicol. Which, agent for killing the saprophytic fungi are you using? Cycloheximide. What is the pH? Something acidic, 5.6. And obviously, the name has dextrose in it. So Sabauroud's dextrose will obviously have dextrose in it. Okay, having said that, now the next technique that I'm going to do is I'm going to take a little bit of this culture with a loop, and I say I want to look at it under the microscope. That is the next thing that I desire to do. So what am I going to do? Repeating once again, I am going to take a little bit of that sample from here, and I'm going to look at it under the microscope. Whenever I look at anything under the microscope, I need a stain, and that is a blue color stain called lactophenol cotton blue. What do we need to know about it? So there are, as the name suggests, lacto, phenol, cotton blue. So when I say lacto, means lactic acid has been used. Why has lactic acid been used? Lactic acid is going to help in preventing or preserving the morphology of the fungus. Lactic acid is going to help in preserving the morphology of the fungus. Okay, when I say lacto, then next is phenol. So why have we added phenol? I think everyone knows phenol is a disinfectant. Yes, so you want all the other miscellaneous things to be killed. So yes, you're adding a disinfectant along with phenol. We also have glycerol. Glycerol is something, the name doesn't have it, but please remember, glycerol is something, glycerol adds a little bit of water. When I say that it adds a little bit of water, it is something which is going to be hygroscopic. That is the description given to it. When I say hygroscopic, means anything that is going to prevent drying. Anything that is going to prevent drying, because it's providing that hygroscopic, that water ability, that is glycerol. So remember that, because it's not in the name. We only call it lactophenol cotton blue, but it also has glycerol. And finally, you have cotton blue. What is cotton blue? Cotton blue is the dye. Cotton blue is the one that is actually going to add the color to it, the blue color, and you can see that under the microscope. Finally, the color that you've got is a blue color. So let's repeat. When I say lacto, phenol, cotton blue, lacto is for preserving morphology, phenol is a disinfectant, we studied it. Glycerol is another thing that we have, which is going to give all the water and prevent the drying, and cotton blue will give the color. So tell me, are you putting lactophenol? Now comes the real question, so make a table around it. Are you putting lactophenol cotton blue directly onto the sample? No. You are first growing the sample on a culture plate. From the culture plate, you are taking the sample and putting lactophenol cotton blue. So it is used for studying culture morphology, and that has been one of the most famous questions of the previous years. What is the stain used for studying culture morphology? It is lactophenol cotton blue. Well, having said that, almost coming towards the end of the culture media. So the main culture media was obviously SDA. But if I do a little bit of twists and turns, there is another culture media called the corn meal agar. And now I'm going to tell you the story of the 3 C's. So when we talk about corn meal agar, you know in which situation will you use it? When I want to grow chlamydospores. When I want to grow chlamydospores, that is exactly when I use corn meal agar. And I've already told you chlamydospores are grown or are grown by which particular organism? Candida. So repeating once again, when I'm talking about corn meal agar, I grow chlamydospores in it, and which organism shows you that? Candida shows you that. So that's another agar that you have to know. Then, because we are talking about Candida, I'll add another C onto that Candida, because Candida is also grown on another agar known as the chrome agar. Candida is also grown on chrome agar. So that will tell you chrome. Chrome means what? Multicolored. You're going to get an agar with a lot of colors. So again, C for C. Chrome agar is something that you grow. Candida, and you can see Candida tropicalis, albicans, cruzi, so many other things written. Do you have to learn these colors? No, you don't. You just have to know that yes, there is a Candida, and that Candida is basically grown on this colorful media. Okay, coming to the last one, suddenly everything's going to become black. So you either call it a birdseed agar or you call it a birdseed Niger agar. And why so? Because Niger word is going to tell you about that brownish blackish color. And this is very famous. I'm not telling you the pathophysiology behind it right now, but this is very famous for Cryptococcus. How to learn this? What is going to be the mnemonic? What is the story of Cryptococcus? We'll come to that. It has something to do with birds. So yes, you will be able to learn it very, very easily. But for the time being, remember, if I see a brownish color Niger, brownish color agar, that's a birdseed Niger agar seen with Cryptococcus. Well, having said that, if we want to do a very, very quick recap of whatever we have studied up till now, and that is something that I've introduced in these lectures, because I feel that there are some topics which are very image heavy. So while you study, you feel you analyzed it well, but towards the end, you obviously feel that you need a quick summary of a minute or two so that everything that you studied in the past 15-20 minutes can be summarized quickly. This is what is going to help me. So if I show you all the pictures of what we have studied up till now, what is that modality which is going to give you that black color? I think everyone knows black color is going to be with gomori, methenamine, silver stain. So like I said, the black color is always going to be something with silver. So gomori, methenamine, silver stain. Okay, coming to the next, suddenly it becomes everything pink. So P for pink, and you're going to get what? P for pass. So we are going to now label it as pass. P for pink, P for pass. Coming to next, something is becoming fluorescent. As soon as we say fluorescent, we are going to use calco flower white. Remember, flower had the word fluorescent, calco flower white. Look at the next three. The next three are for the same organism, and that is Cryptococcus. What do we need to know about Cryptococcus and this? The first one must have been the CSF sample, because I'm using negative stain. I'm using India ink negative stain. The second one must have been a biopsy sample, because I have something red in color, and that is going to be mucicarmine. And like I told you, what is the agar? Something to do with birds and black, right? So there is a bird seed Niger agar. There is a bird seed Niger agar that we have, that sums up the entire story of Cryptococcus. Okay, what is the usual agar that we use? So yes, the first picture out here, the first picture is going to be the SDA, right? The Sabouraud's dextrose agar. Remember what was the pH? The pH was 5.6. And from that SDA, if I want to grow something as a culture morphology, so for culture morphology, the blue color stain that we use is lactophenol cotton blue. Finally, coming to the colorful media, which is the one that requires a colorful media. So this is known as the chrome agar. Chrome because it has so many colors, and C for C, chrome agar is very, very important when it comes to Candida diagnosis. So yes, this is one slide which wraps up everything that you have studied up till now in this chapter in the most concise manner. And before I make you practice a few questions, please remember, coming all the way back, you have done the culture, but there are some other things also that you can do. You can do antibody testing. That is one thing. You can do skin tests, which are not very commonly done, but like you had skin test for TB, skin test for leprosy and others. Similarly, for fungal organisms also you have skin tests. And lastly, something that you can do possibly anywhere starting from bacteria, virus and then fungus also is a polymerase chain reaction. So nothing very fancy about these three things that I had to tell you, but yeah, the direct examination with KOH, the stains and the cultures, those are the most important. Let's do a quick recap, and also now let's practice one or two questions which might help you. So that is a question that is going to help you now. There's a patient who's presented with scaly skin, redness, irritation and small blisters all over his skin. The doctor suspected fungal infection and sent his skin scrapings to the laboratory. Which culture media is useful for culturing the fungus? So firstly, even if you would have read the last sentence, which culture media is used for culturing the fungus, you know for a fact that for fungal organisms, the culture media is SDA. But obviously, the purpose of this question is not this. You have to tell me the others also, because by now I'm assuming you've heard throughout the bacteriology section also. So when I talk about potassium tellurite agar, do you all remember this was a selective media? This was a selective media that you had for what? This was a selective media for Corynebacterium diphtheria, right? Yaad aa gaya? Okay. When we say triple N, for triple N I had told you NNN media is used in two things. Number one, it is Leishmania, that is Kala Azar, and the other one is going to be Trypanosoma cruzi. So I hope you remember Leishmania was the organism causing Kala Azar, and Trypanosoma cruzi was the organism that was causing Chagas disease, and for both of these we had NNN medium. Lastly, coming to chocolate agar, can be used in so many things, but one place where it was important was Haemophilus influenza. Do you remember that concept of satellitism? So yes, Haemophilus influenza can definitely be grown on a chocolate agar. So over here, because fungus was asked, your answer is simple. It's going to be SDA. Coming on to another question that we have, which of the following is not dimorphic? First, you will have to learn and recall which were the dimorphic fungi, and now you will be learning which of them is not dimorphic. So please remember, we had a mnemonic, right? Body, heat, probably changes shape. Can you do a quick recap with me? B was for blastomyces. H was for histoplasmosis. P is for Penicillium marnefi. So something to do with marnefi, Penicillium marnefi was mentioned. Next we have paracoccidioidomycosis. Then we have coccidioidomycosis, and then we have sporothrix schenki or sporotrichosis. So what do we have to know? Now once again, Talaromyces marnefi. See, whether you call it Talaromyces marnefi or Penicillium marnefi, it's the same. So is this a dimorphic fungus? Yes. Coming to sporothrix schenki, sporotrichosis, is that a dimorphic fungus? Yes. Histoplasmosis or histoplasma capsulatum, yes. So which of them is not dimorphic was the question, and not dimorphic is Cryptococcus neoformans, because I think everyone remembers Cryptococcus was the yeast form. When I say yeast form, means Cryptococcus was the one that was showing me budding. So the answer over here is option B. Yes, with that, we wrap up our discussion of the introductory part of mycology. Now we are going to start off with the next portion, and that is the superficial and the subcutaneous mycosis, which you've already studied in the classification. Now we are going to go into the details. The last part of mycology that we need to begin with are going to be the opportunistic infections. Now, please remember, under the opportunistic infections, there is a certain list that we are going to have that you must take care of, which is very important, especially when you're dealing with the virus that is HIV, because this is the list of things that you'll get with HIV as opportunistic. So, Cryptococcus candida, Aspergillus, Mucor, and Pneumocystis, out of which I hope you remember, Mucor was just a member of the family. The actual family was Zygomycetes, right? Okay, so let's begin one by one. Let's begin with the first one, and that is going to be Cryptococcus. Please remember, Cryptococcus is having many things under it. There is something called Cryptococcus neoformans. There's something called Cryptococcus gattii. For all practical purposes, the pathogenic one that you call is Cryptococcus neoformans. Now, what are the things that you already know about Cryptococcus from your prior knowledge? Do we know that it is a true yeast? Because I told you that it is the one that is going to show you budding, right? So yes, it is a true yeast. And we also know one more thing, that I was doing that negative staining for it. Why? Because it had a capsule. So it has a polysaccharide capsule. Now, whenever something has a capsule, the capsule is going to be antigenic. And the capsule that is antigenic will help in serotyping. So what are the different serotypes on the basis of capsule that I know? So earlier they used to just write it in the books as ABCD and a hybrid known as AD. So this is what was written in the books, ABCD and a hybrid known as AD. But now I'm going to change that a little. I am going to write A, D and AD together. A, D and that hybrid AD I'm going to write together. Whereas B and C I'm going to write in a separate version. Why is that so? Because A, D and AD are coming under Cryptococcus neoformans, and B and C are coming over the next one, and that is Cryptococcus gattii. Because if you check your Q bank and you check your PYQs, also your GTs, you will come across this question, and that question is that how many serotypes does Cryptococcus neoformans have? So don't mark 5. Cryptococcus neoformans has A, B, A, D and AD, the hybrid AD, AD, whereas Cryptococcus gattii is going to have the B and C serotypes. That's a question you'll find and come across. I hope you don't get it wrong. Okay, having said that, now that we're talking about both of them, why don't we do their differences also, difference between Cryptococcus neoformans and gattii. So remember, the Cryptococcus neoformans is found all over the world. Cryptococcus gattii, see the way you're going to write gattii, a lot of things will come across it. So when we write gattii, we have double T, double I, and I'll tell you how to learn that. Firstly, in terms of distribution, there is going to be tropical and subtropical. So tropical words are going to come. It's going to come across tropical and subtropical regions. Next, please remember, when you're talking about the isolation, where are you going to find it? Very important. So one of them is found in the soil around the trees. One of them is found in the soil with pigeon droppings. So ultimately, both of them are ultimately coming from the soil, but one of them is found in the soil around the eucalyptus tree. The soil around the eucalyptus tree. And how do I learn it? Because gattii is sounding like a tree. Whereas on the other hand, that is Cryptococcus neoformans, it is going to be on the soil with pigeon droppings. So how is it going to come to us? If the soil has pigeon droppings, how is it going to come into our system? By inhalation. So one of the routes by which it is going to come, which I'll tell you in exactly a minute, is going to be inhalation. So the isolation is simple. Both of them are in the soil, but which is the soil with the tree? So gattii is going to remind you of tree. Okay, next, immunity wise, please remember Cryptococcus neoformans is usually seen in immunocompromised patients. That is why you are always going to see this in HIV positive or immunocompromised patients. Whereas Cryptococcus gattii, if you look at I and I, this means both the immunity people can show it. This can be seen in immunocompromised patients also, and this can be seen in immunocompetent patients also. So always remember this. It can be seen in immunocompromised and competent. That is why a double I is going to help me here. Talking about the treatment, which of them is easier to treat? So obviously I say that because this GATI is happening in immunocompetent and in compromised, this is the one that is actually going to have a more prolonged treatment, because this seems to be doing more harm, because it can happen even in people with normal immunity. So that is the one that is going to require a prolonged treatment. So my simple way of learning GATI was the mnemonic GATI. So GATI is telling me T and T, tropical and subtropical, I and I, immunocompetent and immunocompromised. T is telling me the tree, eucalyptus tree, and Cryptococcus neoformans is going to be around the soil with the pigeon droppings. Having said that, when I say that there is Cryptococcus, when I by default mean, I am talking about Cryptococcus neoformans, means I'm going to talk about the soil with what? The tree or the pigeon droppings? Means I'm talking about the soil with the pigeon droppings, which also means that how is this going to reach us? It is going to reach us by a mechanism of inhalation. It is going to reach us by a mechanism of inhalation, which means it's going to come into the lungs. But tell me one thing. When you read about the symptomatology of Cryptococcus neoformans, is it pneumonia as the symptom that you read very commonly, or is it cryptococcal meningitis? Right, meningitis, na? So please remember, it's the lungs where it enters, but from the lungs, it rather than settling over there, it goes into the blood and goes to different organs, particularly the brain, causing meningitis. So lung is just an en route. It's just a bypass kind of a thing, that okay, just a method of getting inside the body. Inhale, get inside the body, as soon as you reach the lungs, go somewhere else, and that is the meningitis. That is why most of your patients you're going to get as a case of cryptococcal meningitis. Now, having said that, please remember cryptococcal meningitis is going to be diagnosed in 3-4 classical tests, some of which you already know if you've done the first part of this chapter. So please remember, if you have a patient of meningitis, the sample that you will be taking will be a CSF sample for obvious reasons. If you've taken a CSF sample, what is the testing that you prefer? There is a negative stain that we are going to do. When we say negative stain, what we get is India ink or nigrosin. What we get is India ink or another stain known as nigrosin. So you can see, right, that the background has got the color. The background has got the color and the capsule is unstained. The capsule has been highlighted. Capsule will not pick up the color. So capsule will be shining. So if the background has a color, the capsule will come out as highlighted. Okay. Now on the other hand, this is if you were getting a CSF sample. What if you end up getting a biopsy sample? You know this question already. If you get a biopsy sample, what is the stain? Why is it looking so rose pink or this kind of a color? Because you have stained it with something known as mucicarmine. You have stained it with something known as mucicarmine. Okay, having said that, the story is not over. These were only your stains. But if you have to grow it in a culture media, what is that culture media known as? First will always be SDA. SDA shows you a mucoid colony, and this concept I have told you earlier also. Whenever we are dealing with capsulated organisms, like do you remember there was an organism called Klebsiella? Klebsiella was capsulated. Klebsiella was capsulated and showing you a mucoid colony. Cryptococcus is also capsulated. It is also going to show you a mucoid colony. So that is a common trick that I'm telling you for all the capsules. It's going to show you mucoid colonies. But if you grow it on something else, there is something known as Niger seed or bird seed or Kaffik seed agar. How do I learn so many names? Firstly, when I'm talking about Cryptococcus neoformans, pigeon and bird is definitely one thing that I have to keep in mind, because pigeon droppings is what I'm inhaling. So something regarding birds has to be there. And if I look at the culture, it's all brown. So this is Niger. Niger word always tells you brown, right? So Niger seed. And Kaffik. Kaffik is reminding me of coffee, caffeine. Coffee, caffeine, Kaffik. That is also brown in color. So coffee is brown in color. Niger is brown in color. And I'm dealing with pigeons. So all your names are sorted. Niger seed agar, bird seed agar, Kaffik seed agar. But now your question will be, why brown? What is the reason for it to form brown? Brown color is due to melanin. And why is that being produced? Because of the enzyme called lactase or phenol oxidase. Very, very important previous year question. The enzyme responsible for this is phenol oxidase or lactase. Okay, finally, if someone asks you what is the confirmatory test, it is LAT, and you must have seen this in previous years. LAT stands for latex agglutination testing. LAT stands for Latex agglutination test. So repeating all these tests once again because Cryptococcus is really important. Firstly, if you get a CSF sample, you are going to go ahead with a negative stain. If you get a biopsy sample, you're going to go ahead with a mucicarmine stain. And when you have to do a culture media, SDA, because it's capsulated, it will show you a mucoid colony. If you have to see that brown color, the cafe, bird seed, Niger seed agar, the reason for the brown color is the enzyme that it has called phenol oxidase or lacase. The confirmatory test is going to be latex agglutination testing. Last point, how do you treat a case? What is the treatment protocol? So especially for meningitis, because that is what I'm most interested in, there is LAM, that is liposomal amphotericin B is given along with flucytosine. So remember, LAM and flucytosine are the primary stay of treatment. Having said that, opportunistic infection Cryptococcus is done. What do I move on to next? We move on to Candida. I know as soon as I mention Candida, what comes to your mind? Candida albicans. But now I want you to change that mindset. Obviously, albicans is going to be the most common one, but I've got a long list of organisms that I have in front of me. So first and foremost, where did I place Candida in my classification? Remember, I called it yeast-like. Can you recall for me? What do you mean by yeast-like? So yeast property that it has is the budding property, and when I call it yeast like, that basically means it's going to show me the presence of pseudohyphae, right? So yeast like and pseudohyphae, budding and yeast, both are going to be there, and the most common is Candida albicans, of course. Candida albicans has a double twin brother. Double means when whatever albicans will show, doubliniensis will double it and show that as well. So copycat twin brother. So remember, albicans and double it up, that is doubliniensis. Other than that, we have something known as Candida glabrata. Glabrata is not going to show you. See, glabrata sounds like ghabrana. Ghabrana means you are going to leave everything very quickly. You're very scared of something. So it says, okay, I will show you budding. I won't show you pseudohyphae. I don't want to show you everything. I don't want everything. So ghabrana, glabrata or ghabrana is not going to have the pseudohyphae. Okay, next talk about Candida auris and Candida krusei. Candida auris and krusei are the ones which are resistant to azoles. Basically, for the treatment, we give azoles, but which are the ones which are resistant to azoles? So auris is going to be resistant to the azoles, and we have krusei. So please remember that when you're going on a cruise, obviously when you go on a cruise, you have become resistant to the world, means you are cut off from the world totally, because cruise, there is no phone connectivity, no net connectivity, you're only in the water, so you are cut off and resistant and away from everyone in the world. So when this Candida has gone on a cruise, it has become resistant. That is the most important. Also, auris is resistant to the azole. So auris and krusei, kruse is resistant, cut off from the world. Finally, like in bacteria, remember when you see when I told you bacteriology and I told you how antibiotic sensitivity is done, you have to know whether the bacteria is sensitive to an antibiotic or not. Same way for fungus, you have to know whether a fungus is sensitive to an antifungal treatment or not. So what is the control? In all those sensitivity and susceptibility testing, which is the one that you use as a control, and that is control. What is control? Control is something very kifaiti. Kifaiti means something which is very useful. Control is going to help me control everything. So kefire is very kifaiti, means it's going to control everything. So remember, Candida kefire is going to be the control. Repeating once again, what all do we have out here? We have Candida albicans as the most common. Albicans has a double twin brother, everything same, that is doubliniensis. Candida glabrata is ghabrana, so it leaves away something, it leaves away the pseudohyphae. Candida auris and krusei, cut off from the world, that is resistant. And Candida kefire, kefaiti, it is used as a control. Having said that, now when I talk about Candida moving forward, I am in general talking about the most common one that you know, that is Candida albicans. Okay, so firstly, what all sites is it going to, be a normal part of? It's also a part of our normal flora, right? It's a part of our GIT, it's a part of our genital tract, of our nails, of our skin, of our mucosa, even in the internal organs. So it's definitely a part of our normal flora. And now I'm going to tell you that when the immunity of the person goes down, down for whatever reason, maybe it is because of HIV or whatsoever, when the person is immunocompromised, then this normal flora can only end up causing infections, right? So what are the different types of infections? And this I've all written because I think when you start enumerating, every part of the organ of the body is affected. So let's go with the common ones. The common ones is mucocutaneous. When I talk about mucocutaneous, one of the most common pictures given to you will be oral candidiasis. There'll be, and I hope you all remember, there is a curdy white. I'm going to show you pictures in a while. There's a curdy white, very famous curd-like discharge or membrane that you're going to see. That can be in the oral cavity, so that is oral thrush. Go below the oral cavity, you have the esophagus. That can happen in the esophagus. Or what all other mucus sites you know in the males and females. In females, you have vulvovaginitis. In males, you have balanitis. Then, of course, eyes can be affected, ocular. So, like I said, gradually you will realize all organs are affected. Then what else? In kids, you can have involvement. One of the very famous ones, the next one where you get a question, that is diaper rash. Nails can be affected. Paronychia and onychomycosis. Nails are affected, of course. And after that, every organ is possible. From the bladder to the heart to the lungs to the brain. Every organ possible. So where am I going to get the maximum questions? Either I get a question on oral candidiasis, or I get a question to do with gynecology, that is vulvovaginitis, or I get a question in pediatrics on diaper rash. These are the three main clinical scenarios that you're going to get, and one of them I'm going to discuss with you because I have already discussed that with you in your pathology lectures, and that is the very famous candida, right? Cervix, what do you see over here? Per speculum examination, you see the very famous curdy white discharge. As soon as we talk about the curdy white discharge that you see with candida, now you're going to look at it under the microscope. Do you remember there was a very famous shish kebab effect that we had studied in pathology? If not, then you can go back to your lectures and go into it. When we talk about the shish kebab effect, please remember I'm ruining a very interesting and a tasty dish for all of you. But what is shish kebab? So shish kebab and curd are ruined from today onwards because candida looks like curdy white, and shish kebab will tell you there is a skew, there's a stick, right, on which you put all the pieces of kebab. So that stick is actually the pseudohyphae. That stick is referred to as the pseudohyphae of candida. And where are those pieces of kebab? You can very well see these different pieces of kebab that are going to be there. So please remember, these pieces of kebab are nothing but the epithelial cells of the cervix. These are the cervix cells which have, stacked up like pieces of kebab. So remember, there's a stick which is the pseudohyphae, and then there are pieces of kebab on top of it. Let's mark it. So you can see an imaginary stick, a straight line going, and then you can see these various cells which are stacked up like pieces of kebab. So you'll have to imagine that why are they stacked up like pieces of kebab? Because one imaginary line must be holding them, and that is the pseudohyphae. Okay, having said that, this is about one of them. Similarly, can you see the same curdy white discharge in the oral thrush, in the diaper rash? Yes, the same curdy white appearance is going to be seen. Having said that, like you said that, this is a part of your normal flora also. So you're going to see this when the patient is immunocompromised. So what are the conditions in which this is going to happen? So basic concept is that when the immunity is going to go down, or there is some immune problem that has happened. Now, if I want to enumerate those things, when the person is very, very old, immunity goes down. Diabetes, healing and immunity is problematic. In steroids, the immunity, there's an immunosuppression that is done. Pregnancy, again, is one more problem. Immunocompromised or immunodeficiency states like HIV, or a patient is undergoing a transplantation, patient has been put on some immunosuppressant drugs, or patient is born with some conditions in which his neutrophil count is low. Obviously, if his neutrophil count is low, he cannot fight infections. So yes, that is something again problematic, and it is seen very commonly in infants in the form of a diaper rash. I don't think there is anything new or fancy that I have told you out here, because the basic concept remains the same. Any situation where you play around with the immunity, candida can happen after that. Okay, having said that, I'm going to show you pictures on what exactly is candida going to do. So here we have, as I told you, candida is going to be a yeast-like organism, means it's going to have a bud also, and it's going to have a pseudo hyphae also. And let's correlate that. So when I say it has something like these tiny projections, these tiny projections are going to be the budding form. These tiny projections are the bud. And when I say it has these long buds, when the buds become very long, so these long buds are referred to as the pseudo hyphae. So the tiny ones are buds and the long ones are known as pseudo hyphae. That is why I called it a yeast-like organism, right? Now let's try and grow it on a culture media. What is the famous culture media for all the fungal organisms? It is SDA, but what is Candida going to show you on SDA? So there's a way of how it is written in the book and there's a way of how we will learn it. So please remember, it's written as something known as very famous. Look at the color. Firstly, it is looking cream color. It's not looking like a pearly white. So first thing that we'll write is creamy in color. Next, it looks like paste. It's not like a powder, it's like toothpaste. So paste. And next, yeasty. What do I mean by yeasty? That everyone's, the smell that you get when bread is being baked, bread or any bakery smell, which all of us are very fond of, that is because of yeast and fermentation. So that kind of an odor is going to come. So how I have learnt it is a kind of a rhyme, okay? Yeasty, creamy, pasty, yeasty colonies. That is how we learn it. It is going to show you the creamy, pasty, yeasty colonies. Okay, having said that, what else? So it's showing you budding, pseudohyphae, creamy, pasty, yeasty colonies. Now we come to all the C's and the G's that I had taught you. If you remember, I have already taught you that when you're talking about Candida, and you grow Candida in a medium known as the cornmeal agar, you see something known as chlamydospores. So when is spore formed? Spore is something that is formed when the surrounding or the situation is tough. So cornmeal agar is one of those tough media which is basically deficient in a lot of nutrients. That is why the organism starts becoming a little tough. Repeating, so C for Candida, if I grow it in C for cornmeal agar, I'm going to see C for chlamydospores. And how do I identify chlamydospores? Going to the first part of the chapter. I had told you that chlamydospores are going to be identified by their double wall configuration. It has a double wall configuration that we have over here. Having said that, I'm not over with the C's. There is one more C that you have, and that C is going to be the chrome agar. Can you grow Candida in the chrome agar? Yes, this is a chrome agar. This multicolored thing is a chrome agar. So remember, C for chrome agar, C for Candida. So all the C's now I've got you, right? C for Candida, C for chrome agar, C for Candida, C for cornmeal agar, C for chlamydospores. There's one last test left. I'm going to change the C into slightly something. So this time the C is going to change into a G, and that is going to be the germ tube test. And what is the other name for a germ tube test? It is known as the Reynolds-Broad phenomenon. Repeating, C for Candida, C for chrome agar, C for cornmeal agar, C for chlamydospores. Now the C changes into a G, germ tube test or Reynolds-Broad phenomena. What is this test? So what do? I take the Candida and I add human serum to it. I take the Candida and I add human serum to it, and suddenly after incubation I see there is an entire hyphae or a tube that has come out. That is why I called it a germ tube. I see an entire tube has come out of it. That is what you call as the germ tube test. Now I want to tell you something. Did I tell you that all of this I was talking about Candida albicans, but did I tell you that Candida albicans has like this duplicating brother, twin brother who's going to follow it everywhere? Did I tell you that Candida albicans has a brother called Dubliniensis? So now when I'm saying germ tube test is positive in Candida albicans, means it's positive in the twin brother Candida Dubliniensis also. When I'm saying that Candida albicans is showing you the chlamydospore, this means not only Candida albicans is showing you the chlamydospores, but also Dubliniensis is showing you the chlamydospores. So like I said, copy paste. Whatever I'm telling you for albicans, Dubliniensis goes hand in hand. So now you will ask me, okay, that if I'm talking about germ tube test, both of them show you the germ tube test, double. If I show you the chlamydospores, both of them show you the chlamydospores. So how do I differentiate? I have to have some point. Even twins have something different in them, right? So remember, the tougher twin, the tougher or the most common one is the tougher one, means which can grow above 45 degrees, albicans can grow. Which can grow in hypertonic saline, albicans can grow. So anyone at high temperature, at hypertonic saline, all these tougher environments, albicans is the elder brother, he will grow. twin also. One twin is born always elder and one is younger. So albicans is the older twin. That will survive everything, and doubleniensis is that chota wala twin. So that is not going to survive all these tough situations. That is how you differentiate albicans and doubleniensis. I hope everyone's okay with this. And if you want to differentiate all the other organisms of Candida, what are you going to use? The colorful media. If you want to differentiate albicans from glabrata, from cruzi, from tropicalis, all these different ones, then you use the colorful media. You don't have to learn the colors. There is a reference chart. We compare the colors and we give the diagnosis. Finally, coming to the treatment, I have already told you that azoles are going to be the treatment. And which were the two which were resistant to azoles? I think that part also you guys have analyzed. That is going to be Candida auris and Candida krusei. These are the ones which are resistant. So for most of the cases, azoles are given. For these two very common ones, that is oral thrush and vulvovaginitis, topical nystatin is also preferred. For severe, we can go for azoles or for nystatin. But for deep candidiasis, for organ involvement, for deep candidiasis, liposomal amphotericin B is given. So usually it is azoles and nystatin, and for deep it is going to be lamb. Okay, having said that, Cryptococcus done, Candida done. What do we move on to next? Now let's go on to Aspergillus and Mucor. These are the next set of organisms. So when we talk about Aspergillus or we talk about Aspergillosis, first thing that I want to tell you is there are different types of aspergillosis, right? So you must have heard of something called allergic bronchopulmonary aspergillosis, something known as disseminated or otomycosis. So there are 4 types. Let's start. When I say ABPA, what is ABPA? ABPA stands for allergic. So there is an element of allergy involved. Allergic bronchopulmonary aspergillosis. Allergic bronchopulmonary aspergillosis. That is how you come down to the short form ABPA. Firstly, as soon as I mention something has an allergy, which hypersensitivity am I trying to hint you towards? With allergy, I try to hint you towards type 1. So please remember, this is a combination actually. It is a combination of type 1 and type 3 hypersensitivity reactions. That is point number 1. Point number 2 is that why is this patient having this condition? Because whenever there is repeated and heavy exposure of the spores, see, allergy always happens after repeated exposure. If there is a repeated and a heavy exposure to the spores, that is when this condition is going to happen. That is one thing. So ABPA, very common question asked, and examiner is quite smart. He doesn't write the word ABPA. He will write something like, he'll rearrange the words. He will say bronchopulmonary allergy. So the word aspergillus has been removed. So even if ABP is mentioned, you should know it's a part of ABPA. Okay. Having said that, the next variety of aspergillus is going to be aspergilloma. As soon as I start using the word oma, we start thinking of tumors, right? So this is nothing to do with the tumor. It's just to tell you that there is a well circumscribed lesion. Just a tumor hota hai, well circumscribed like that. So if you see in the lungs, there is actually a well circumscribed lesion over here. You know what is this? This is nothing but aspergillus, which will grow in a pre-existing cavity. In a pre-existing cavity. What do I mean by that? Let me give you some examples. For example, I say I have a patient who already pre-existing, who already has a cavity in the lung. Why would someone have a cavity in the lung? So let's draw it out. Why would someone have a cavity in the lung? Either he's had some secondary TB. Secondary TB leads to cavities. Let's make quick causes list of cavities in the lung. Secondary TB will have cavity. Then even, histoplasma can result in cavities. TB and histoplasma anyway have to come together. That's our rule, right? Next, which cancer can result in cavities? Squamous cell carcinoma can result in cavity. What else? Bronchiectasis. Bronchiectasis is also going to result in cavities. So imagine any of these diseases. Actually, cavities have a long list, but what I have mentioned over here is what you will find in all your PYQs. Either they will say there is a case of TB or histoplasma, or they will say there's a bronchiectasis, or they'll say there's a cancer called SCC. Now, having said that, cavity is already there. Who goes and sits inside that cavity? Aspergillus goes and sits inside that cavity. So that is aspergilloma. So remember, does aspergillus cause the cavity? No. Does aspergillus go and sit inside a cavity? Yes. Coming to the next, disseminated one. So because it's going everywhere in the body, you will call it invasive aspergillosis. Easy to learn. The last one is Superficial. Superficial includes otomycosis, means involvement of the ear. And yes, this is one of the aspergillus fungal growths that you can see when you put the, when you viewed the canal, the ear canal, you saw the growth, fungal growth happening. So superficial is going to include otomycosis. Now, having said that, let's take a sample from here. Let's look at it under microscope, and then let's look at it under your, under the different culture media also. So when I talk about this, and that is aspergillus, first I'll tell you the mnemonic. That is how, everything is going to become a little simple. When I talk about aspergillus, please remember, A is going to be for acute angle dichotomous branching. There is acute angle dichotomous branching. And what do I mean by that acute angle dichotomous branching? So acute angle less than 45 degrees. So you can see wherever the branching is occurring, it's occurring at a less than 45 degree point. So look at it in the real picture. See, the branching is less than 45, here less than 45, here also less than 45. So number one, I've understood what is acute angle. Acute word is done. What is dichotomous? Like the branches of a tree. See, from 1 there are 2. From 2 there are again 4, from 4 there are 8, from 8 there will be 16. This concept is known as dichotomous branching. 1 to 2, 2 to 4, 4 to 8, double, double, double. That is how we go. So number 1, A for acute angle dichotomous branching, and number 2, SPE will mean that it has the presence of septate hyphae. It is going to have the presence of septate hyphae. So SPE for septate, because now you will realize that there are lines present. There are some lines present. Those are septations. Look at this one more picture over here at the bottom. We can zoom into it. So you will realize, look at the kind of branching. The kind of branching is all acute angle branching. And look how from 1 to 2, 2 to 4, how it's going all throughout dichotomous branching. Also, do you see lines? Yes. Can you see the lines or the septae inside it? Of course, this is a septate hyphae. Okay, so that is about how it's going to look like. Now you need to know how is it going to look like under the culture plates. So this is what you need to know for the culture plate. So first I'll tell you which are the 3 main aspergillus that you have to know. This is Aspergillus fumigatus. Then we have Aspergillus flavus. Then we have Aspergillus niger. And there is also referred to as something known as, I'll come to another form, but that's a very rare one. So first we'll focus on this. When I'm talking about Aspergillus fumigatus, it shows you something known as smoky green colonies. I can see the green color, but it's a smoky green colony. Aspergillus flavus, some people call that it looks like a slice of kiwi fruit. So yes, we see the presence of yellow-green colonies. And Aspergillus niger is going to show you the blackish color colonies. And how do I learn all of that? Please remember that niger, see, niger word is anyway going to tell you that it is something to do with black. So this is the easiest to identify. The confusion actually comes between these two, fumigatus and flavus. So see, when we talk about smoke and fumes have to come together, right? Smoke and fumes. So smoky green is going to be the fumigatus one. Whereas yellow green, such beautiful colors, they remind me of a color of a flower. So flavus should be like flowery colors, yellow, green, beautiful colors. So flavus, flower, that is my mnemonic, flavus, flower. So simple. In the exam, if I get confused, there is something called flavus, that is to do with flower. There is something called smoky, that is fumes. So fumigatus is to do with smoke. So that is fumes and smoke. And niger, of course, niger is, the word is only telling me something has to be brown, black. So that is what you are going to analyze, right? Okay, there's one culture plate that is remaining, which I'm going to come to in a while. But first, let me finish off these 3 main ones, that is Aspergillus fumigatus, flavus and niger. Now you want to look at these under the microscope. What stain will you put? If I want to pick up a little bit of this and look at it under the microscope for the culture morphology, you will put a lactophenol cotton blue. Before I show you, try to get a basic outline of what are you going to see over there. So please remember, you don't have to learn everything, just get oriented so that when you see, you should know that, this is somewhat like this. You can see a conidiophore. You can see this vesicle, this round little thing called vesicle. Then you have one row of something called metulae. You have one row of something called phyllides. And then you have one row of or 2 rows of conidia. So this is something of what you should be knowing. I'm not telling you to know everything, but now when I show you the different species, it's going to make a lot of sense. So when I talk about this, please remember, Look at the first one. This is Aspergillus fumigatus. Firstly, why is it looking blue? Because what have I used? I have used something known as lactophenol cotton blue. Means what am I trying to see over here? I am trying to see the culture morphology. I hope that is simple for everyone. Having said that, what do we move on to next? Look at this. Can you see this vesicle? There is a conical vesicle, and all those medullae and whatever we were talking about, medullae, conidia, they are all on top of it. But please remember one thing out here, that now comes the real deal. And if you solve this, most of your questions in your Q bank are solved. Where do you see the conidia and the medullae? Are they arising from all around, or are they only arising from the upper part of the vesicle? So remember, the conidia are going to be present along the upper part of the vesicle. The conidia are going to be present along the upper part of the vesicle. How did I learn this? See guys, fumes kahan honge? Fumes and smoke always go up. So I will always see something which is only along the upper part, because I consider these as fumes. So you will say they'll only be seen along the upper part. Versus, look at the next one. Look at the flower, the flavus. Flower is going to be something that is going to have petals all around. So can you see the vesicle is going to have these conidia all around? That is the best way of learning it. So when you're dealing with Aspergillus fumigatus, fumes are only above, so the conidia are above. When you're dealing with Aspergillus flavus, it's like a flower, it's going to go all around. And when you're dealing with Aspergillus flavus is done, so this is actually a mixture. So you could see an element of flavus here, because you could see something going all around. But what you're seeing here, this is quite characteristic. We see Aspergillus niger. Why did I call it niger? Because I can see a blackish color forming. So simple. If it's everything, it's flavus all around like a flower. And if it's only brown, then you call it Aspergillus niger. I hope that is clear with everyone. And yes, now coming back, we are left with one last and a rare one that you should be knowing. And this is the last one that you should be knowing regarding not this microscopic image, but definitely the culture media is needed. And what color are you seeing? You're seeing a classical beige color. You're seeing a classical beige color. So the last one, which is a little rare, but you should be knowing if you're aiming for the higher exams, and that is going to be something known as Aspergillus terreus. Now, what is this? Firstly, you can see the color that you're getting. It's a beige color. For those who don't know what is a beige color, I'm sure all of you have seen cinnamon. Yes, cinnamon you've seen, you've tasted cinnamon. Yes, cinnamon is also brownish. So it's a shade of basically a whitish brownish color. So how have I learned it? So Aspergillus terreus tea. Cinnamon tea is very famous. All of those who are tea lovers, I give very few tea mnemonics. I usually give a lot of coffee references because I'm a coffee addict and a lover. But yeah, this is one of the tea references for all the chai lovers that we have. So cinnamon tea is something that most of the tea lovers really like. So yeah, cinnamon tea, terreus is going to look like tea. So cinnamon is the color that it has. But yeah, this is not very important. If you're aiming for higher exams, you should be knowing that this is the cinnamon tea, which is very resistant to azoles. It's not going to give a good response to azoles. Okay, having said that, coming to, before we go on to the treatment, there is something about a toxin and a poisoning that I want to teach you about, which I have already taught you in the pathology lectures also. And that is aflatoxin. Let's break it. When I talk about aflatoxin, I've understood that it is a type of a toxin. When I've talked about A is obviously for Aspergillus. And which Aspergillus are we talking about? Flas. So we are talking about flavus. Aspergillus flavus releases a toxin called aflatoxin. And you know what this toxin does? This toxin can enter into our body and cause a mutation. It can cause a mutation at codon 249 of the P53 gene. What will happen because of that? Because of this, the patient can land up with hepatocellular carcinoma. So yes, aflatoxin has been linked with HCC. But now I understand that how would you must be making faces, because you must be thinking, how will I learn codon 249 of P53? So remember, the way you write P53, just fill in the blanks of the numbers that are missing, right? So you write a 2 over here because 3 is already written. Then you write a 4 over here because 5 is already written. And with this P, what can I do? Which number can I make? If I invert it, I get a 9. So what is the codon did I end up making? I ended up making 249. Now is there going to be any confusion about the codon? Because these are question examiners mean at times and writes 149, 248 and all of those. So you'll just write a P53. You'll write a P53 and you're going to fill up the numbers 2, 4 and 9. So codon 249 of P53 gene is what is mutated, and that results in HCC. So obviously a question must be coming to your mind that a fungus can cause cancer. How does the fungus enter into our body? So remember, aflatoxin or Aspergillus flavus is a very famous ground nut or a peanut contaminant. It is a ground nut or a peanut contaminant, and that should not stop you from eating peanuts or groundnuts, because all us medicos, we have this habit of reading things and then applying it all to ourselves. But this is some long-term storage. If groundnuts and peanuts are stored for a very, very long time, and that too in very moist and damp conditions, that is when fungal growth happens in them, and that is when, if consumed, it can cause this mutation. Having said that, what is the treatment aspect going to be? Remember, so depending on, whether there is an aspergilloma. So for example, if there is an aspergilloma or something that is growing in the cavity, you might need a surgical treatment. But a question that has become very, very famous is, what is the treatment for disseminated aspergillosis? And that is voriconazole. Very, very important. I hope you remember voriconazole was also used when there was recently it's a drug come up for chromoblastomycosis also. But yeah, disseminated for aspergillus. Your disseminated aspergillosis, very famous question nowadays. Remember, when you go to your Q bank, you are going to find this. Okay, having said that, now coming to aspergillus is done. So aspergillus has a cousin brother family, and that is mucor. After COVID, you know the importance of mucor and the so-called black fungus, but mucor is not one organism. It belongs to a family known as Zygomycetes, and the most famous time pass of all microbiologists is changing the names. So remember, Zygomycetes is also referred to as the glomerulomycetes now. So what does it have? It has RAM. Zygomycetes has RAM in it, that is, it has rhizopus, it has absidia. Again, the name of absidia has changed to lichthemia, which if you can learn, very good, and mucor. So remember, rhizopus, absidia and mucor. This much you should know, that is RAM. So now, first I see three things. Firstly, I have told you something. If you remember, Zygomycetes was coming under what? It was coming under the A septate hyphae. The A septate hyphae were having Zygomycetes. So look at these hyphae. Do you see any line in any of them? No. They are all clear. They don't have any septate. They are aseptate. And also, how will I identify? So look at this. When I say rhizopus, what do I understand by rhizo? Rhizoids. There are going to be some rhizoids, or there are going to be some roots. Rhizoid is root. So when you see a fungus with a root, the root is nothing but a rhizoid. Root is nothing but a rhizoid. So the organism that I'm going to think of is going to be the rhizopus. Okay. On the other hand, if I see that, yeah, there are roots present, but there's a little difference in the arrangement. See, earlier in rhizopus, wherever the organism was there, the root was just below it. But in absidia, I see that the organism is over here, but the root is in between. The root is coming in between the organism. So that is how you differentiate the root, because root is going to be seen in both, in rhizopus also and in absidia also. So if the root is just below, if like a root, it is just below, it is rhizopus. And if the root is going to be in between, then you're going to call it an absidia. What am I left with? I'm left with mucor. You can see mucor does not have a root. So easiest to identify. It's aseptate and it's not going to have a root. Okay, having said that, now coming to the next one, and that is, how do we go about the clinical symptomatology and everything. So remember, first and foremost, we are talking about the rhizopus. Where were the roots present in the rhizopus? Just below, right? Okay, this causes rock disease. What is rock disease? Rhino-oculocerebral disease, a very famous triad that you will see. Rhino-oculocerebral disease, that is rhizopus that you're talking about. So rhino means there's going to be a nasal discharge. Oculo means there's proptosis that is there, and CNS means cerebral means delirium. So even if you don't remember individually and you remember the rhino-oculocerebral disease, that is what is important. So yeah, that is the primary form. And the second most important, the second most will obviously be the lung involvement, like most of the cases. So even for rhizopus and mucor, the primary will always be this triad, the rhino-oculocerebral disease. The second most common involvement will be the lung. Go to your Q bank. That's a question that I have leaked. Okay, having said that, why did, coming to the mucor of this family, mucor became very, very important in COVID, because many people who had taken steroids for COVID, and I've told you steroids has an immunosuppressant action. It can decrease the immunity. So many people started having these black color lesions only because Clinically, it was coming across as black lesions. Clinically, there were black lesions seen. Otherwise, there is nothing black about the fungus. But the common man started calling it black fungus. But we as microbiologist experts know that it is nothing to do with black. Okay, so for example, someone comes to you with this. What are you going to do? You're going to look at it under the microscope. So first and foremost, if you guys remember what was aspergillus, then other things are opposite. So tell me, in aspergillus, what was the branching? There was an acute angle branching. So in mucormycosis, what is the branching going to be? Either it's an obtuse angle branching or it's a perpendicular 90-degree branching. Bilkul opposite. Okay, aspergillus was what? SPE, that is, it had septate hyphae. It had septate hyphae. So what is mucor going to have? Mucor is going to have aseptate hyphae. Mucor is going to have aseptate hyphae. And one last thing, remember, mucor and M and R, mucor is mota. Okay, if they ask you which is the broader one, which out of aspergillus and mucor, which is broad and which is like a ribbon. So remember, mucor is broad, M for mucor, M for mota. So remember, mucor is mota and R for ribbon, it is going to be ribbon-like. So everything that you have studied, let's see this picture. Have a look at this image. Can you see there's a straight line? Do you see any lines inside it? Any septate? No, they are aseptate. Look at the branching. It's coming out at, look at this. Branch is coming out at exact 90 degrees. So it's a perpendicular or an obtuse branching. And it's definitely mota. It's broader, broad and ribbon-like. Having said that, how will this look like under the culture media? So for culture, all of us know we are going to have the SDA. It has something very characteristic. I'll tell you a very interesting thing. So see, I just called mucor as mota. That continue with that mnemonic. So if mucor is mota, and anyone who's mota should not fit in very easily. So mucor is not going to fit in. If you put it in a culture plate and you try to fit in, it's not going to fit in. So remember, when you're trying to grow it in a culture plate, suddenly you will see that the lid will be lifted. They are referred to as lid lifters. Why are they called as lid lifters? Because they are so fluffy. They are like cotton fluffy. See, mota fluffy. That is what mucor is. Mucor is very mota and fluffy. So because it's so mota and fluffy, I call it fluffy like cotton wool. It is fluffy like cotton wool, so it's going to lift the culture plate. It's going to lift this. So if this is the, if this is the lid is going to be lifted. So that is why it is mota and fluffy like cotton wool. So it's going to be called as lid lifter. So that mota mnemonic is going to help you. It's mota, it's broader than aspergillus, and because it's mota, it's fluffy. So it's also known as the lid lifters. Okay, finally what we are left with is going to be the treatment, and I think everyone knows that whatever blackish lesion is formed is surgically resected, and obviously amphotericin B, like all other cases, is used. Posaconazole is something that is coming across as an alternative now, so that you should be knowing about. Okay, now another thing that became very, very famous in COVID following this aspergillus and mucor scare were two tests, if you remember. There was something called beta-1,3-D-glucan testing, and then there is something called galactomannan testing. There is something called galactomannan testing. So what were these two tests which were being performed so much? And if you start reading articles, I'll show you the article and you'll actually get very scared. So look at this. This is the article. There was something called beta-1,3-D-glucan testing. There is something called galactomannan. What are these? These are components present in the cell wall. The cell wall of the fungi have something called beta-1,3-D-glucan and galactomannan. So now you realize that this is positive. Let's see, beta-1,3-D-glucan positive in Candida, Aspergillus, Pneumocystis, Histoplasma, Fusarium, dermatophytes, even cocci. Oh my god, so many things it is positive in. Same for galactomannan. Galactomannan is in Aspergillus, Fusarium, Penicillium, so many things. Can anyone possibly learn this? Not at all. So let's take the easier route. Let's find out what is it not going to be positive in. That will solve half my life. So remember that black fungus, the mucor, black fungus was actually positive for none. Neither did it come positive for beta-1,3-D-glucan, nor did it come positive for galactomannan. So mucorales or mucor is not going to be positive for either of them. Now what do I have to know further? Please remember the mnemonic B, M, C. means the beta-D-glucan is not going to be positive in blastomyces, it is not going to be positive in mucor, it is not going to be positive in cryptococcus. So better way out is learn the non-positive, learn the negative. So blastomyces, that figure of 8 wala blastomyces, then the mucor, mota mucor, and finally the cryptococcus. These three you are not going to find beta-D-glucan. Other than that, it is positive in everything. For galactomannan, remember it is not positive in mucor, rest it is positive in everything. That's a better way of learning this table. Okay, having said that, what is the last opportunistic infection and the last part of this chapter that you have to know? That is Pneumocystis carinii. And I have already taught you one thing about Pneumocystis carinii. That is, when we were talking not about the cell wall, particularly when we were talking about the cell membrane, if you guys remember. When we were talking about the cell membrane, so I'll quickly revise. I had to revise it so we can quickly study. Remember, every fungus has a cell wall. And what is the cell wall containing? Cell wall contains chitin. Next, every fungus has a cell membrane. And all the cell membranes contain what? They contain ergosterol. But which is the one which does not contain ergosterol? And that was Pneumocystis carinii. Now, before I go into the story of Pneumocystis carinii, I will first tell you one mnemonic, and after that you can keep reading the theory, because once you learn this mnemonic, everything is simple. So how I will learn Pneumocystis carinii is going to be PCP, PCP, PCP. 3 times I'm going to write PCP. Why do I do that? So let me tell you, we'll write PCP thrice because the entire story is finished off in PCP. So P means I am talking about Pneumocystis. The name of the organism is carinii. And what does it cause? Pneumonia. So what is the disease that it causes? Pneumocystis carinii pneumonia. Whenever someone suffers from Pneumocystis carinii pneumonia, remember that person has a lot of plasma cells. So this is also known as PCP, plasma cell pneumonia. This is also referred to as plasma cell pneumonia. Okay, so whenever someone has PCP, Pneumocystis carinii pneumonia, you will see a lot of plasma cells in his lungs. And lastly, why is this known as PCP? Because this shows you the ping pong ball appearance, and that ping pong ball that I'm talking about is crushed. So there is something known as a crushed ping pong ball appearance. Repeating, PCP, PCP, PCP means what? I'm dealing with PCP, Pneumocystis carinii pneumonia, PCP that is plasma cell pneumonia, PCP that is crushed ping pong ball appearance. With this entire outline, let's start with the discussion. So when I'm talking about Pneumocystis carinii, someone asks you, what are the clinical features? I told you, it is Pneumocystis carinii pneumonia. So there's going to be pneumonia features that will be there. And these patients come to you with dry cough. They come to you with dry cough. So that means sputum production is not going to happen. What sample will I then take from the patient? Because when there is no sputum sample, I will have to go ahead with bronchoalveolar lavage. The sample that I take from the patient is bronchoalveolar lavage. And now you will tell me that when I've taken a bronchoalveolar lavage, which are the cells that I will see maximally in it? That's why I called it plasma cell pneumonia. So we see lots and lots of plasma cells under the microscope. Fine. What else did you see? We saw the very famous crushed ping pong ball appearance. So it's time that we start seeing that crushed ping pong ball appearance. So let's see the image that we are talking about. So have a look at this picture. Firstly, why is this picture looking extremely black? It is looking extremely black because we have used something called Gomori methenamine silver. We have used a stain called Gomori methenamine silver stain, and please remember this Gomori methenamine silver word comes and I know I'm getting a black color. Okay, what can you see? You can see some round appearances. Those round appearances are referred to as what? The ping pong ball. After that you say, let's crush the ball. So I can see a lot of places where it is crushed. It has been crushed. So now I call it what? I call it the crushed ping pong ball appearance. But then came the people who are good in imagination. They said it is crushed in a manner that it is looking like a helmet. So, okay, they started calling it a helmet or a hat. They started calling it hat appearance, helmet appearance. Then some said some of them are crushed, some of them are round. So, it's looking like a cup and saucer. That came across as another name now. That came across as an other name, that is the cup and saucer. So repeating once again, there is a crushed ping pong ball appearance. That crushed ball can look like a hat. So some of them look like hats, some of them look like cup and saucer. But the stain is something that they will put up to you, because no gram stain or anything is going to help you. GMS will help you. Gomori methenamine silver will help you. Coming back, we have done all of that. We have done the stain. I've told you the stain is Gomori methenamine silver. Can you cultivate it? And the big answer to that, the biggest answer, the biggest no possible that you have to write, because I have already told you in this entire chapter, there are 2 organisms which are non-cultivable. Can we repeat? One is going to be this Pneumocystis carinii, PCP, and the other one was Rhinosporidiosis. You cannot cultivate these 2, Pneumocystis carinii and Rhinosporidiosis. Finally, what do you give for the treatment? Again, a PCP. That's the last PCP that we have. For Pneumocystis carinii pneumonia, remember cotrimoxazole and pentamidine. So P for pneumocystis, obviously. For pneumocystis, what is the first drug you will consider? Cotrimoxazole. And you can also go in for pentamidine. So now coming all the way back, can I add the last PCP in this situation? So the last PCP will be, the P stands for pneumocystis, that is the organism. The C stands for the treatment, that is you're going to give cotrimoxazole, and you can end it up with pentamidine in case it's a severe infection. Okay. Having said that, we finish off all the opportunistic infections. You know we are up for 2 things. One, we have to do a very quick 2-3 minute summary of all the images, and next we have to go ahead with a few questions. So quickly, let's start with the images. I've tried to get everything in 1 or 2 slides, which has been tough, but we'll try. Okay, so first, what do I see in these first 3 images? I can see that there is a negative staining that has been done. So there is some kind of negative stain, maybe it is India ink. The next one, I can see there is a mucicarmine stain done, and then there is something which is written also. There is a bird seed or a Niger seed agar or a caffeic seed agar that has been done. So basically all 3 together, what are they telling me? This is a classical case of cryptococcus. Classical case of cryptococcus that you have to know. So we have what all? We have the negative staining, we have the mucicarmine and the bird seed agar. Coming to the next is a classical thing related to so many pictures of Candida. Can you start marking all these pictures of Candida for me? So first and foremost, I could see what kind of a discharge. We could see a curdy white discharge. That's the first thing that you analyze. Other than that, this is the very famous shish kebab effect. So that's the next image that they are going to give you. Candida shows you a shish kebab effect. Let's move forward. Let's go into the famous Candida pseudohyphase. So yes, we see the presence of pseudohyphae, and that is a very important word for Candida. Then all the C's are going to come. Which kind of spores are going to form? These double-walled spores are going to be chlamydospores. So one of them is going to be chlamydospores. On which agar do you see chlamydospores? They are very commonly seen on C for C, corn meal agar. They are very commonly seen on a corn meal agar. What else? Which agar otherwise you're going to see? We are going to see the very famous colorful agar. So for Candida, another C, that is a chrome agar, is going to come to our rescue. But if I would have used a usual agar, if I would have used a usual SDA agar, remember that rhyming thing? Creamy, pasty, yeasty colonies. Yes, creamy, pasty, yeasty. Am I left with any test? All the C's are done. Now you make a C into a G. Am I left with something known as the very famous germ tube test? So now zoom out and see the entire spectrum. You see the very famous curdy white discharge with the shish kebab effect. Pseudohyphae are seen. Creamy, pasty, yeasty colonies are seen. All the C's, chlamydospores are seen on corn meal agar. Then chrome agar is used for it, and you make it a G, so you get a germ tube test. Candida is done. Now we go on to the difference between aspergillus and mucor. I hope you remember which of them is going to show you. So you can do a comparison of 2 on the same. Which of them is going to show you acute angle branching? So aspergillus will show you acute angle branching, and aspergillus is going to have those lines. When I say it has lines, means aspergillus is going to be the one that is septate. Mucor is totally opposite. It is obtuse angle branching, it is aseptate, and remember mucor was the black fungus which is mota. Mucor is the black fungus which is mota. That is why I gave you one mnemonic. It is mota and fluffy. So what kind of colonies will it have? It will have the very famous cotton wool colonies, and because they are mota, they will not fit in. So we call it lid lifters. I hope everyone is clear with the difference between aspergillus versus Mucormycosis. Now, when you're talking about Aspergillus, might as well we finish off the different types of Aspergillus and their colonies. So, first and foremost, we label it as A, B, C, and D. The A1 is the smoky green one, smoke and fumes. So, A1 is going to be Aspergillus fumigatus. The B1 is going to be the flowered nice yellow-green colors, so flowery colors, that is Aspergillus flavus. The third one is going to be the brown color, so that is going to be Aspergillus niger. And the fourth one, which is a rare one, but Aspergillus terreus, because we had learnt it that tea, cinnamon tea, it's going to have a cinnamon color. The same thing when you look under the microscope. If you see conidia in the upper part, conidia like fumes only in the upper part, it is fumigatus. If you see conidia all around, it is flavus. And if you see something to do with black color, it is niger. Coming to the last organism, which again needs no introduction because PCP, 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 4 times we did. Let's do a very, very quick recap. The first PCP is Pneumocystis carinii pneumonia. What cells will it show you? PCP, plasma cell pneumonia. What is going to be the appearance? Ping pong crushed ping pong ball appearance. What is the treatment for pneumocystis? It is cotrimoxazole and pentamidine. So all these 4 things together make up the the tetrad PCP of Pneumocystis carinii. I hope that quick revision has been good. Quickly we'll solve a few questions. Which is the organism which is going to show you the Reynolds-Broad phenomenon? It is a multiple choice question, so with more than one answers are needed here. Reynolds-Broad. What is Reynolds-Broad phenomenon? It is a germ tube test. When I'm talking about germ tube test, albicans will definitely show and its twin brother will double it up. So which are the 2 organisms that are going to show you? Albicans and Dubliniensis. Coming on to the next question. What is the morphological feature of Pneumocystis carinii pneumonia, PCP? You can never forget this. PCP shows you, does it show you hemorrhage? Does it show you plasma cell abscess or ARDS? No one's going to get that wrong ever. So remember, it is going to show you plasma cell pneumonia. So lots and lots of plasma cells will be seen. On what sample? Do you get a sputum sample on Pneumocystis carinii? No, we usually go ahead with a bronchoalveolar lavage. Moving on to the next one, let's read it. Guys, here we have a vitreous aspirate from a case of endophthalmitis. Sounds to be a major case. Gram-positive oval cells, 12 to 14 microns in size. There is presence of gram staining showing you pseudohyphae. So the first thing that I told you in this lecture was that when you're dealing with gram staining, don't just only think of bacteria. Gram staining is something that can come in fungal organisms also, right? So yes, and when I'm seeing pseudohyphae, the only one that has to come to my mind is going to be Candida. Pseudohyphae definitely going to be Candida. Okay, moving on, coming to the next one. Which colony has been shown over here? The colony of Aspergillus shown in this picture is what? You can see a smoky green color. Now, when I'm seeing a smoky green color, the colony that I'll be talking about will be Aspergillus smoke and fume. So, I'll be talking about Aspergillus fumigatus. Okay, having said that, coming on to the next question, beta-1,3-D glucan testing is done for. So I told you, rather than learning what it is done for, let's learn what it is not done for. So what is it negative in? It is negative in BMC. Do you remember? B was for blastomyces, M was for mucor, and C was for crypto. So I don't see any of those. Candida mein hoga, fusarium yes, Aspergillus yes, Pneumocystis yes. So it is done for what? It can be done for all of these. What is it not done for is going to be BMC. Okay, moving on, coming on to the last question that we have a lactophenol cotton blue staining that you have. There's a case of panophthalmitis with cellulitis in an elderly diabetic patient showing obtuse angle branching, point number 1. Second, they are aseptate, and third, they are mota, broad. What is your likely diagnosis? So obtuse angle with aseptate and broad. I know I'm dealing with the case of mucor, but mucor is not written. Is any family member of mucor written out here? Which can cause oculo involvement also. Family member zygomycetes, RAM, that is Rhizopus, Absidia and mucor. They are under the same family. So what is the best answer that I can pick up over here? I can pick up Rhizopus. So yes, with that, not only do we wrap up the entire section of opportunistic infections, but we also wrap up our mycology. I hope you have enjoyed it, to say the least, and I hope you have been able to grasp most of the concepts that we've done. You just need to quickly go through the question bank once, and that should help you remain sorted for the fungus aspect. Thank you.